How does Nevada rank in supporting our children's well-being and growth? The good, the bad, and a path to get better. That's all next on Nevada Week.
Support for Nevada Week is provided by Senator William H. Hernstadt, Cashman Equipment, De Castro Verde Law Group, Nevada State Bank, Valley Electric Association, and additional supporting sponsors.
Welcome to Nevada Week. I'm Kip Ortenberger, and thank you as always for joining us today. Well, our statewide children's report card is out, and Nevada is at the bottom of the class. Our overall state grade is a D. That's D as in dismal. The question is, why such a low grade? And what does this mean for the present and future of our children? Well, to best answer these questions, we're talking with an expert panel in reviewing the recently released 2019 Children's Legislative Briefing Book to get a better understanding of where we have the biggest gaps and where we can make our biggest gains. Please welcome the leaders from two organizations that developed the briefing book, Tara Phoebus, Executive Director of the Nevada Institute for Children's Research and Policy at UNLV, and Denise Tanata, Director of the Children's Advocacy Alliance. We are also very honored to have Amelia Pak-Harvey, an education reporter for the Las Vegas Review-Journal, and last but not least, Patricia Farley, former Nevada State Senator for District 8 in Southern Nevada. Thank you so much for being here. We really appreciate it. And Tara, I'd like to start with you. What is the Children's Briefing Book, and what is its purpose?
So the Legislative Briefing Book is a document that we put together at Nevada Institute for Children in partnership with the Children's Advocacy Alliance to really serve as a resource for decision makers in our state. We cover kind of some key areas that impact the lives of children and families and provide detailed information on kind of where Nevada stands in those areas. And in the most recent years of the briefing book, we have kind of aligned that with the Children's Advocacy Alliance and their report card. So their report card comes out at the same time and includes a lot of the same issue areas, and so we thought it would be great to be able to integrate those two documents where we can have the grades from Children's Advocacy Alliance, explain a little bit more about that information, and then have the detailed data that goes along with each one of those. So really we design that to be, like I said, a resource, and we do it in partnership not only with the Children's Advocacy Alliance, but with a lot of the issue area experts in our state to be able to make sure that we're covering those things that they're seeing in their daily practice.
And we'll talk about the report card in just a second, but the research, the data that you're getting for the brief portion, what kind of sources are you getting that data from?
So it comes from a number of different places, so kind of depending on available information and the issue itself. We try to do a good job of making sure that we're looking at regional information as well as state level data, and then doing that comparison across other states in the country. One of the things that people always ask when they look at numbers is, well, is that good? Is that bad? How do we compare to other states? How do we compare to national numbers? And so look at those kind of national data sources as a really good resource for us in presenting that information.
And Denise, to compare and contrast that with what the report card is, how are we determining what the grades are for the report card portion?
So for the report card, we're really looking at how Nevada compares to other states. So a lot of the data that we're using for the report card, we have to be able to compare apples to apples, Nevada with other states. So it's a lot of national data sets that we're using. Sometimes the data's a little bit behind. And one of the things that we like to note with that is that oftentimes while we see the grades for Nevada are relatively low, we are recognizing that we're making a lot of improvements in those areas, but as other states also make improvements, it keeps our grade a little bit lower. So just a point of note in looking at those grades.
So the overall grade of D does not necessarily mean we haven't improved year to year. It's just that everybody's improving too.
Exactly.
So because we do have that overarching grade of D, I mean, how are we faring in general then if we are comparing ourselves to states, or just how we've done from a year-to-year basis?
Well, the Children's Advocacy Alliance has actually done the report card. We do it once every 2 years, and we've done it for 20 years now. And we've had a grade of D since our second report card in 2002. So we're seeing that the grades are pretty consistent, relatively low in almost all indicators. But with that being said, we are seeing improvements. Of the 20 indicators that we look at in the report card, in this most recent one, 13 of those are actually improvements for the state of Nevada. And I think with recent developments in some of the areas, we're anticipating seeing some of those grades improve in future report cards.
What are some of the areas that we score high on comparatively to other states?
Childhood obesity is an area that we've done well in over the years, although the caveat with that is that we're starting to see a decline. It's one of the indicator areas where we're actually starting to go down instead of making improvements. We also relatively are doing well around substance abuse, which can sometimes surprise some folks here. It doesn't mean we're doing really good in that area and we don't have room for improvement, but compared to other states, we're doing relatively well.
How about low grades? Where are we? What's our bottom basement grades?
You know, I think probably the one that stands out the most is education. We've consistently ranked, gotten a grade of F, not only overall in education, but in each of the indicator areas under that for many years. Like I say, that being said, we've also been making consistent improvements in education. So when we're looking at academic achievement, high school graduation rates, funding for education, we are making steady improvements in those areas. We just have a long way to go to catch up with the rest of the country.
And so we're making improvements in the education funding, but yet our grade is still F. And Amelia, I would like to ask you, the Review Journal has extensively researched the funding formula and where we are with education funding. Where are we in our current funding formula? What are some of the gaps that you see?
I think to just cut to the chase, that there needs to be more money, bottom line. And I find a reluctance among folks to talk about just raising taxes. So I feel as though Nevada has been taking these steps, baby steps to improving education funding, and we've pumped billions over the last few sessions under Governor Sandoval. I kind of try and equate it to we want to be here, and we started out here, and the billions got us here. We still have a long way to go. So long and short, we need more funding, and that's because the Nevada plan from 1967, it's over 50 years old. It does not account for the students of today. Clark County back then was significantly less diverse, less poor, fewer English language learners. So all of those populations need more resources and more money. So I think there was a study that came out that I think is cited in your report card, but the Augenblick study that said that 9,000 and change is the best, or adequate at least, and we currently spend about 5,000 and change. So
almost half of what we should be spending.
Yeah.
Patricia, Governor Sisolak has pledged in his State of the State, and then after that he's going to really work with legislative leadership to review, is the word he uses, what the current formula is. In our next session, which is coming up, do you foresee that we can change the funding formula in one legislative session, or are we looking at a succession of sessions?
I think a succession of sessions. Obviously, you can't go into, particularly with Clark County schools with the size of it, and change the way it's funded in one session because it'll be chaotic. But so I think it's got to be in multiple sessions. It's got to be starting small in certain areas. I think in the 2015 session with the categorical funding, it kind of started outlining some of the urgent areas of need, but I don't think categorical funding, while a good idea, needs to be in the overall equation. So that kids are getting what kids need and not some formula that has no relevance to what their actual education needs are. And to Amelia's point, it is money. And we saw all the candidates start out, and we all intend to start out by saying we need to raise more money. And if you look at the Nevada plan, about 9% comes from federal, and the rest is divided between the state and locals. So property taxes are an issue. Business taxes, although the businesses are continuously getting hit and funded, our property taxes are low, and our the formula to figure that out is off. It doesn't make sense to where we're going as a state. And we have to also be careful of the abatement issue, because we bring these companies and all these employees, and we're missing payroll taxes and other taxes that are getting abated, and those go to our schools and our localities and our parks. And so I think there's a lot of resources and options. We just need somebody in there that's going to make the hard choices and say, hey, this is what we need to do, and this is how much it's going to cost, and we all have to share.
Denise, you have quite a bit of experience being up in Carson City and working as a lobbyist for children's issues. How do you foresee funding working? Is this going to be a multi-session movement, and where is the money going to come from more specifically?
I mean, I agree with Patricia. I think it's a multi-session issue, and I think it's already, there have been interim committees. That work is ongoing. We know that there are a couple bill draft requests right now going into this legislative session that will be addressing education funding, the funding formula, putting in weights that are more relevant to our current population. But the big issue is the funding. We're not going into this session with any more money than we would have had before. So you can change the funding formula, but that doesn't create a pot of money to fund it. So I think, I agree with Patricia. I think, getting the funding formula right is important, but it's equally as important that we look at what resources are going to be available to fund that, and other social service programs that quite frankly impact the ability of our kids to be able to succeed academically. I know there's been a lot of discussion about the marijuana funding and that going into education. That's obviously a factor that will be addressed in this session as well. That alone is not enough, to do what we need to do moving forward. So I think it is going to have to be a discussion about other resources, looking at what other states are doing, how are they funding that, and making some hard choices.
And let's broaden this discussion of education funding to not only include K to 12. Let's talk about pre-education and child care too, which is another gap. The briefing book, the child report card portion of it also has a F- for school readiness after early education. What are we missing in early education related to funding?
So Nevada currently rates 41st in per pupil expenditures for 3 and 4-year-olds, so that preschool age. So we are spending significantly less money as a state on very young children. And then we can back that up even further to some of the child care issues and what we spend on subsidy to improve access to care, and initiatives that we have related to quality. Now, like Denise mentioned, we've made some great improvements. Last session there was a lot that went forward towards improving access and quality, but kind of like Amelia was saying, is if you start down here, you can do a whole lot of work to get here, but if you need to be here, there's still a long way to go. And that's something that we continue to, to talk about and provide information about, because that early childhood period is just so critical, and not only for those education outcomes, but for other long-term life outcomes for children. We have to have kids that are ready to learn when they enter our K-12 system. If they start behind, many of them never catch up. And so I think continuing to look at early childhood and 3 and 4-year-olds, but not just at 3 when we get into preschool, but looking further back than that, and making sure that those very, very young children have access to quality care and education as well.
And not only outcomes for the children themselves, but we're talking about working families here, and a lot of times the low income and the middle income working families are the ones that have the hardest access to childcare. Amelia, you've done a lot of research and a lot of articles on early education as well, and the limitations. What kind of impact does it put on a middle-income working family?
It means quite a lot, actually. And to Tara's point, I think it's often kind of criticized as glorified babysitting, but it's actually so much more than that. I was at a kindergarten classroom last week, and those teachers can tell when those students have had pre-K or not. So it's not just throwing a bunch of 3 and 4-year-olds into a classroom and playing. I mean, they are playing, but it's developing that social aspect and preparing them for school. So there's that aspect that stays with them for a while, and some of these families might be working. That's really important to have that preschool access while the parents are away during the day. So it really is a big difference. And a lot of research supports that.
And I read in the briefing book, too, that we have had a 52% decline in licensed providers. So where are most of, especially for low and middle income families, where are they getting their childcare provision?
So we know that just over a third of 3 and 4-year-olds are enrolled in some kind of center-based childcare. That's a relatively small proportion of those kids. So the rest of the kids are either in-home childcare. We have. There are sometimes people assume that if you're paying someone to watch your kids, even in their home, that there's a licensure requirement, but there isn't. It's based on how many kids you have in the home that kind of prompts that licensure requirement. So before that, there is no licensure requirement. So that's where kind of that number comes from, that if it's a small in-home childcare, then that's where they are, or they're home with parents, or they're with family, or kind of bounced around with however the parents can make it work so that they can get to their job and do what they need to do to support their families.
Patricia, you spent quite a bit of time in legislation. Do you see the direction that our state should go in supporting the more unlicensed, informal type of childcare where we have a lot of our children, or should we look at programs that are funding the licensed portion and really trying to uplift the amount of subsidies we have for children to be in those programs?
So the latter, for sure. And I like the home-based, the mom. Some of that is good, particularly if you have an active parent in the raising of a child, right? Particularly for education. But going back to the point that was made earlier, it's so critical for your child to be ready to learn, that there's skills. And it's just a brief personal story. I have an 8-year-old that never had that, and a 9-year-old who I raised, right? Reading books, storybooks, looking at pictures, so that when you read, you actually comprehend what you're reading, and you teach a child to comprehend as well as read words on the paper. To a child that hasn't had it, and it's amazing to me how far behind, both in vocabulary, understanding of the world, being able to read and comprehend. And so where one child will be able to flourish and go on to continue to read, to learn, I'm still trying to teach another child. And those things are things that we do as parents, right? You get home, you read a book, you talk about things, you tell what the definition is. And if you can't do that as a parent, then it needs to be done in preschool by quality educators who know what the steps are in developing a child. And so if we are going to be funding, we need to be funding children to be successful adults. And so I certainly hope that as parents, we take that to the legislature too, especially those who are legislators, and fund appropriately childcare, early childcare.
I want to switch gears and talk about mental health care access for children as well. Although the briefing book has a higher grade of a C-, this is still, I know, one of the high priorities. Why is mental health care access, Denise, so important?
Mental health, I think, it touches so many different issues. So whether it's mental health access for parents, for the kids themselves, we were talking a lot about education. If a child is experiencing mental health issues, they're not going to succeed academically. It's going to impact. If they have a parent who's experiencing mental health issues, it can impact their ability to succeed and do well. And I think what we see, it's a broader issue around mental health, of generally access to health care, where we have definitely made some improvements since implementation of the Affordable Care Act and Medicaid expansion. Nevada actually had the highest % increase in insured kids in the entire country, but we still are at an F, because it's another one of those areas where we were so far behind that we've got a long way to make up. We are actually starting to see declines in that. over the past year or two. So it's something that we'll need to continue to watch. But just having the insurance card isn't, that's not access to quality care. I mean, I think some of the other issues that we need to look at are Medicaid reimbursement rates. How do we attract quality providers? We've got provider shortages throughout the state of Nevada, and mental health is one of those large areas. So not only looking at those providers, but what we can do in our communities and our schools, looking at things such as assessment tools to identify early on some of those issues that might be impacting the mental health of our kids, looking at suicide prevention, resources in the community. So I think it's the access to health care and healthcare providers is a huge issue, but what can we do in our communities and our schools to support those youth as well?
And Amelia, you've also covered homelessness, suicide issues. How are you seeing those linked to mental health care or lack thereof?
Yeah, it's very linked. And just to expand it beyond mental health care, wraparound services are a big component of a school's success. I was at a school yesterday, actually, one-star school, and I asked the principal, what's the biggest challenge that you see in terms of improving and getting out of this one-star status? And he said wraparound services. So not just mental health, but making sure these kids have food, making sure they have clothing, anything else that's going on in their life, maybe at home or on the streets, maybe getting them interested in college through Gear Up. So that's all really important. And it's a challenge now because the Clark County School District has a shortage of school psychologists, and we're way off the ratio of what we should be, the recommended ratio of one to every 500 to 700 students. I think it's about like 1 to, depending on who you ask, every 1,800 or 2,000 students right now. So there's that, but there's a shortage in a lot of positions in CCSD. So that's one aspect, but it is really important to the success of a school and the academic success of a student.
So let's look at this, from more of an overarching perspective here. When we're talking about all these wraparound services and the funding that goes into something like this, we start talking more about census counts and how important that is. I know there was a special briefing in the briefing book about census counts. Denise, why are census counts so important? Can you explain what the kind of critical mass we're at right now, census count?
Absolutely. As a lot of people know, we're coming up on our 2020 census. The census happens once every 10 years on a national level to get a count of our populations. Why this is so important for a lot of the issues that we've been talking about is there are over 300 federal funding programs, appropriations that go out to states that are dependent on those census numbers. So when we have an undercount, which we did have in the 2010, in fact, nationally, an analysis of the 2010 census found that we missed over 1 million young children ages 0 to 5.
Nationally, and how many did we miss statewide?
We don't have an exact number here in Nevada. What we know, we've determined what hard to count census tracts are. We've got about 68,000 children who are living in those hard to count areas. We know that we missed probably around 13,000 individuals in the state of Nevada. In the 2010 census, it's estimated that per individual per year that equates to about $1,200 in federal funding. So when you start doing that multiplication, you're talking about millions and millions of dollars in lost federal funds for the state of Nevada.
And so when we're looking at the 2020 census, what are some of the barriers that you foresee that is really going to limit where our counts are?
Sure. Some of the barriers that we see coming up, one is the citizenship question that's still currently pending at the federal level. With a lot of things that are happening now around immigrant populations, there's a fear of not only engaging in any type of public service, but even talking to government. So there's going to be a fear probably of filling those out. They're also changing the process for the census this time around into an online format versus the traditional paper format. So access to the internet and those type of resources will all have an impact.
So then, Patricia and Denise, both, what can we do as a state then to close this gap? Is this just an education outreach service, or is there something more we should be doing?
I would say there's a lot. So one, we know through the governor's day of the state, there is going to be an investment at the state level for the 2020 census. There's also some bills pending regarding the 2020 census. One is to create a statewide 2020 census commission to oversee that. But a lot of it is education and outreach, and not just in your traditional formats of traditional media, no offense, but also doing that grassroots outreach. So really connecting with some of the organizations who are on the ground working in those hard to count communities and neighborhoods, and having those one-on-one conversations. Because like I said, a lot of it I think is going to go back to fear of government interaction. So if they have that trusted partner in the community who they're already working with, they may be more likely to participate. So I think a lot of the resources will be going to that grassroots outreach.
Well, thank you. And we're out of time, unfortunately. Thank you so much. We really appreciate all of you being here. And thank you for joining us this week on Nevada Week. For resources discussed on this show, or for more information, we encourage you to visit our website. Also, if you have a topic or issue you'd like us to explore on Nevada Week, we'd love to hear from you. So please find us on social media or email us at nevadaweek@vegaspbs.org. Thank you again, and I'll see you on the next Nevada Week.